Phan from Phan University. My topic today is the immediate effect of volitional and spontaneous breathing on emotion, distracted working memory, and the respective physiological responses. So, in the early history of human, we every day face the natural stressors. So, to then we evolve the emotional response, including physiological, cognitive, and behavioral component for survival. So physiological response includes some internal activities and also autonomic nervous system to support the behavioral reaction. One of the main component of physiological event is breathing, which is very flexible and specific for different type of behavior. Like when fighting or running away from predators, we need to increase breathing. But when we are in the freezing response, we have to reduce breathing to not to be detected by predators. Or when we have the disgusting feeling, then we also reduce the breathing to reduce the risk to inhale some kind of pathogens. But nowadays, life we have to face other kind of stressor from social cognitive problem. So it requires more cognitive control rather than behavioral reaction. So cognitive control helps us to suppress some inappropriate reaction and also keep maintaining the cognitive tasks like working or study. So we wonder what kind of breathing can support us for this adaptation. In our study, we employ the working memory task with emotional distractors, which mimic the daily life problems that we need to perform the task under the negative emotion. So our female healthy participants will have each undergo 4 tasks with different kind of emotional distractors, and also we assign them with different volitional breathing, including slow, deep, and fast shallow breathing, and we investigate how that breathing can help them to cope with that situation. In the main effect of negative emotion, we see here that negative emotion distractors reduce their performance, but volitional slow, deep breathing increase both accuracy and reaction speed, while the volitional fast shallow breathing only increase the reaction speed of the performance. To further investigate, we have the plot of the temporal change of working memory performance, and we notice that in the very beginning there's a lower and unstable performance, but later the volitional slow deep breathing show the higher and stable performance. So we separate our result into the pre-responsive stage, which include the 5 first working memory trials, and the responsive stage, which includes the last 15. Then in the beginning, there's no effect of volitional slow deep breathing, but later the volitional slow deep breathing become obviously effective. Then it implies that maybe volitional slow deep breathing takes some time to activate some underlying mechanism for making the effect. We also have the cross-correlation analysis between temporal change of working memory performance and the heart rate time series, and these significant results imply that the reduction of heart rate time series followed by the improvement of working memory performance. So maybe there's a causal relationship between autonomic nervous system on cardiac activities on the effect of volitional slow deep breathing. Also, we have the other linear correlation between working memory performance and the parasympathetic activities, and also the breathing patterns when we perform the slow deep breathing. If we have if the participant modulate their breathing depth more, then they will be more effective for them to improve the emotional regulation. Also, the fast shallow breathing, they increase the reaction speed associated with the more sympathetic activities. So to identify the spontaneous breathing pattern and how it affects the regulation of emotion, we have the different kind of spontaneous breathing, including the spontaneous slower breathing, spontaneous faster breathing when they are facing the negative emotion, and only the participants who spontaneously reduce their breath under negative emotion, they show the adaptation here. They are less likely to affected by negative emotion and show some parasympathetic activities indicators. In summary, we compare the spontaneous breathing and volitional slow deep breathing and volitional slow fast shallow breathing. And in this study, we observed that there's a co-occurrence between spontaneous slow breathing with a higher tonic parasympathetic predominance, and they are less likely to be affected by negative emotion. While the slow deep breathing, they produce a superior efficacy to reduce negative emotion effect, and that effect is modulated via the cardiac vagal modulation, while the fast shallow breathing increase only the reaction speed, but then this effect is mediated by the sympathetic dominance. So that's all of my presentation. Thank you for listening.
Yeah.